Busy 8:39. Dr. Andrew Forsythe with us, answering pet questions today, and we have some folks on the line, but I know this is a really busy time for you guys with emergencies, so you have some tips for our viewers of things that we can keep an eye out for, what to avoid at this time of the season.
Yeah. Christmas, fall, the cooler weather, things like that really cause problems or some hazards for our pets. Starting from the first one, antifreeze. Antifreeze spills out of your radiator onto your driveway. Try and mop it up. Don't let it sit there. Wash it away. Get it out of there. It's sweet. It causes kidney damage. It's bad for your pets. And just don't think that they won't get to it, because they will. The next one, holiday plants, poinsettias, lilies. Lilies are extremely toxic. Holly. If your cats or dogs like to chew on these around the house, just put them up, put them away, get them, keep them safe. Of course, with Christmas trees, lights, garland, things like that, electrical cords. Electrical cords cause huge, severe electrical burns, and they're very painful. Burns are so painful. The other thing...
This looks very familiar.
Yes, tinsel, ribbon. I'm sure we take these out of cats 3 or 4 times every holiday season. I don't know why they like to eat it, but they do. Glass ornaments can break. They look interesting to the pets. The last one, holiday treats, leftovers, turkey, bones, chocolate. Remember, that's our turkey from a couple years ago with our cat. She is very hopeful. Just remember, if you're wrapping up chocolate or anything like that, don't put it under the tree. They have very good senses of smell. They'll unwrap it early.
Absolutely. All right. Keep them safe. Jolene has been very patient on the line from Abbotsford. Good morning this morning, Jolene. How are you?
I'm good. How are you?
Good. You have a question for Dr. Forsythe?
Yes. I just want to know how you know if your dog has had a stroke.
Okay, a stroke is a very kind of a generic term. And just for the viewers at home, a stroke occurs when a blood clot falls down a blood vessel and occludes it and prevents blood from supplying that area. That can happen in the brain, it can happen along the spinal cord, and it can actually happen in the back legs in cats. It's called a saddle thrombus, a very painful condition. So it depends. It depends on where the stroke is and what the clinical signs are associated with. But they can, yep.
Okay. We have an email. We do have somebody else on the line. Dave from Chilliwack. Dave, you have a question for Dr. Forsythe. Hi, Dave. Are you there?
Yes, I am.
What's
Hi,
your
Dave.
question?
Yes, I have a 14-year-old poodle. We've done a lot of traveling in the car, and the dog is always panting, back and forth from the front seat, back seat, panting. Been in the car an awful lot. Can't stop it.
Okay, he might be motion sick. He might be nervous. I noticed he's out of a carrier. Try getting a carrier, putting him in the carrier so that he can't be up and see out the windows. That might be causing some anxiety for him. Some dogs do better. I know our dog does when she's in her carrier. We crate trained her as a puppy, and so it's nice because they feel that crate is comforting to them. It's their spot.
Safety zone.
Safety zone, yeah. Happy place, I guess.
All right. Okay. Thanks for calling, Dave.
Give that a go, though.
Belinda emailed us. Says she has an 11-year-old Maltese cross that has occasional cough while resting. She said it's short-lived. It sounds like she's just trying to clear her throat, but it's been going on for about 1.5 years. What do you suggest? Is this a sign for lung or heart disease, cause for concern? Yeah,
certainly in an 11-year-old dog that has a chronic, non-productive cough, I would certainly get them into the veterinarian, have a chest x-ray, check that out. The other thing is blood work. It's always a good idea to do some blood work on our geriatric pets to see if there's anything brewing there that we can get a handle on early rather than late. But a chest x-ray for sure. Signs of congestive heart failure in older dogs can be coughs, especially a nocturnal cough or exercise intolerance if they if they run around a little bit and then they start to cough, that's
all right.
time to go in.
Out. Wendy's on the line from Surrey this morning. Good morning, Wendy.
Good morning.
Morning.
What's your question?
My question is, my dog has arthritis in his hip, and can I give him over-the-counter Advil, and if not, why not?
Okay. To try and keep this short, because the real answer is extremely long. A lot of the newer NSAIDs are very, very specific for the receptors that they attack. Advil is an older type of non-steroidal anti-inflammatory drug, and it has a wider mechanism of action. So it hits more of these receptors. The more receptors you hit, the more side effects you have, like stomach ulcers and things like that. So we tend to, because we have these newer products that are much more effective and much more safer, we tend not to use those products anymore. We've just moved on from them. I hope that's, I could give you the 20-minute version.
Is there one that you suggest then? If it's not Advil, is there something else she could do?
Over the counter? No.
Okay.
No, they're all prescription NSAIDs now. Medicam is another one, Deramax, those are the veterinary products. They're actually wonderful products for old dogs. We have our dog on Medicam right now. She's 12, she's got arthritis.
Okay,
It
makes
helps
a big
her out.
difference.
Oh,
yeah, for sure.
yeah.
Okay, thanks, Dr. Forsythe. If you have any more questions for Dr. Forsythe, check out his website, comolakevet.com. You can also follow him on Twitter, right?
Facebook.
Oh, Facebook.
Yeah.
Oh, just Facebook.
What's Twitter?
Yeah, okay, we'll talk. Next weekend, cooking expert Karen McSherry joins us to help some holiday party food conundrums. Send us your questions, weekendnews@globaltv.com. That's next weekend, 8:46 right now. Let's learn more about Velmont from Kate.
Yeah, don't let